World Mental Health Day was observed for the first time on 10th October 1992. It was started as an annual activity of the World Federations of Mental Health by the then Deputy Secretary General Richard Hunter. The day is officially commemorated every year on October 10th. At the beginning, the day had no specific theme. Its aim were general ones of promoting mental health advocacy and educating the public on relevant issues. In the first 3 years, one of the central activities to mark the day was a 2 hours telecast broadcast globally through the US Information Agency satellite system from a studio in Tallahassee, Florida. WFMH board member participated from the studio with live telephone participation from Australia, Chile, England, and Zambia, and pre-taped segment from Geneva, Atlanta, and Mexico City. In the first such telecast, we realized that we were indeed reaching for a field because there was an unacceptable and unscheduled telephone call in from Switzerland, where a group of WFMH members had gathered to view the program, and that year the very first of many feedback reports came from Peru. In 1994, at the suggestions of then Secretary General Yog Brody, a theme for the day was used for the first time. It was improving the quality of mental health services throughout the world. Feedback reports were received from 70 countries soon after the campaign, with notable nations campaign in Australia and the England. In many countries, WFMH board members were instrumental in arranging events. Within 3 years, the day had become a valuable occasion for interested government department organizations and committed individuals to arrange programs to focus on aspects of mental health care. In 1995, a broad range of international events was reported to the WFMS Secretariat from around the world, ranging from a month-long series of events in Egypt to a conference held by the French Federations of Mental Health at the Ministry of Health to a community celebration in the tiny micro-island in the Pacific. In the United Kingdom, where there was a large national program, we also noted the poignant event at the site of the old London Mental Hospital, which gave us the word Bedlam, where many volunteer school children and young people with learning difficulties planted spring bulbs. In 1995, we took particular note of the help offered by the Pan American Health Organization (PAHO) arranged for the translations of the planning kit material into Spanish and made 300 copies of the Spanish version available for distribution to its contacts in South America. Inspired by PAHO's initiatives, the Federation later arranged for the translations and printing of the planning kits in French and Spanish. Many years later, we have managed to translate the material into Spanish, French, Hindi, Russian, Japanese, Chinese, and Arabic. We would like to stress that WMH Days isn't simply a one day event. The preparations go on the months beforehand, and this is truly a long term education effort. In some countries, the program is stretched over several days or a week, or even in some cases, the whole month. And in some places, preparation for the following year starts almost as soon as the current year event is over. Reports come from us from around the world at varying rates throughout the entire year following the 10th October event. The project has evolved over the years to participate run on its own. People all over the world are holding events, making announcements, and celebrating WMH days. They see the importance of public awareness, and we know that our success over the last 26 years mainly been because of the dedications and hard work of the WMHD's constituents. The WFMS created his program 26 years ago to help promote mental health and create awareness about the issues associated with mental illness. We opened the door, and thousands of people from all over the world have run through and out into the street to forever declare October 10 as World Mental Health Day.